Meniscal repair is a crucial arthroscopic procedure focused on preserving the knee's natural shock absorber, the meniscus. Unlike meniscectomy, which removes damaged tissue, meniscal repair aims to restore the meniscus's function. This helps protect long-term joint health and lowers the risk of developing early arthritis. There are 3 primary techniques for meniscal repair, chosen based on the tear's location, type, and the surgeon's expertise. 1. Inside-out technique. 2. All-inside technique. 3. Outside-in technique. Each technique plays an important role in restoring knee stability, alleviating pain, and helping patients return to an active lifestyle. The inside-out meniscus repair is a gold standard and widely accepted technique for treating meniscus tears. This approach involves passing a suture from inside the meniscus to outside the skin. Followed by a skin incision to secure the knot over the capsule. While this technique is robust and versatile, suitable for most types of meniscus tears, it has some pitfalls. The skin incision required to tie the knot can lead to scarring and complications, such as numbness or pain when bending the knee, particularly in bucket-handle tear cases. This can impact the patient's quality of life. Additionally, managing multiple sutures and knots can be challenging. Another technique available for meniscus repair is the all-inside repair. This method utilizes a specialized device with preloaded implants that pierce the meniscus and deploy the implants within the joint, leaving no visible scar on the skin. However, this technique has its pitfalls. The procedure can be quite expensive, and the cost may escalate if the tear is large, as more implants would be required. To address the limitations of traditional inside-out and all-inside meniscus repair techniques, Osteocare presents the Ecostitch Hybrid Meniscal Repair Kit. This innovative solution utilizes Ecostitch, a patented technology that utilizes the benefits of all-inside using an inside-out approach. The Ecostitch kit features 2 0.8 mm introducer needles preloaded with USP size 0 sutures. These sutures act as introducers and are integrated with 0.8 mm all suture anchors. Each anchor is loaded with a USP size 0 suture connected to a pre-tied knot, which is then converted into 2 suture tails. These tails function as cinching sutures, providing secure fixation of the meniscus tear. To initiate the repair, identify the tear and measure its depth using a meniscal probe. Mark the measured depth on the Ecostitch sutures using a skin marker. Next, insert the Ecostitch cannula into the joint space and position it on one side of the tear. Advance one arm of the Ecostitch needle through the cannula until it pierces the meniscus and exits through the skin. Once the needle exits, slide the suture out from the cannula slot and release the cannula. Reposition the cannula on the opposite side of the tear and repeat the process with the second needle arm. After both needle passes are complete, remove the cannula from the joint, completing the initial step of the Ecostitch procedure. Next, slowly pull each needle out of the skin, one at a time, until the anchor comes into contact with the meniscus. Pull the needle until the mark on the suture is aligned with the meniscus, indicating that the anchor has reached the outside of the capsule. Repeat this step for the second needle. Once both marks are aligned with the meniscus, gently pull the cinching sutures through the portal and cinch the knot down over the meniscus. To secure the knot, use a knot pusher with a cutter to slide the knot into place and then trim the excess suture. Finally, cut the suture and remove the needles from the skin, completing the Ecostitch procedure. The Ecostitch technique offers numerous advantages. Ecostitch utilizes a novel inside-out technique, eliminating the need for skin incisions. This all-suture anchor repair technique, developed by Osteocare, utilizes a specially designed pre-cut single lumen cannula to guide the needle loaded with suture and anchor. The pre-tied cinching knot provides a secure intra-articular fixation, resulting in an all-inside repair. Ecostitch offers the benefits of all-inside repair using inside-out techniques without scarring the skin. The needle punctures only 0.8 mm into the meniscus and skin, minimizing disruption to surrounding tissue.